we're gonna look at the neck and shoulders now, which are tight and tense from a lot of use. And we're gonna just see what we can see here. Would you say tense and tight all over through the neck, or are there particular areas that are stuck?
It's hard to tell one spot from another spot.
Okay, so it just feels tight.
It all feels really heavy.
It all just feels tight and heavy, okay. So one thing I notice is a little bit of a protraction, internal rotation of both of your shoulders, which is putting a little bit of stress on your sternoclavicular joints right here. So let's do a little work through there. So landmarks here is her clavicle, here is her manubrium. So that's the sternoclavicular joint right here. It's kind of like a saddle. The clavicle has a knob on the end. It fits into this shallow notch, and it does allow for a lot of movement. That's what gives our shoulder so much mobility. So we have to be careful with the sternoclavicular joint. It's inherently unstable. So anyone who wants to put a lot of force through this joint, I think, is being a little bit unsafe, and I don't approach it that way. What I like to do, probably not surprising if you watch this channel at all, is make sure that the fascia is nice and mobile. So we always have a lot of mobility available to the joint without sacrificing its stability. And the first thing I feel here, well, maybe not the first, but what I do feel kind of significantly is right underneath the clavicle. That's her subclavius muscle right here. And it's really tight. And I think that could be part of what's pulling these shoulders into protraction. Okay, so let's start there. Okay, say that again.
I can feel it in my fingers.
When I work on your subclavius muscle, you feel a sensation all the way down to your fingers.
Yes.
Yeah. So I'm not on her neurovascular bundle. I'm not on the brachial plexus. So that's referred sensation. I just find that really interesting. Yeah, more tinglies in the finglies. That's good. Okay, deep breath here. Yeah, and that is allowing this shoulder to find a more easy, not quite so protracted position. You can see right and left, there's a little bit of a difference already. So let's continue on those lines. And here we are in the scalene triangle, and much more delicate, trachea, and the brachial plexus and subclavian artery and vein are right there. We want to be careful, so not to press right on them. Okay, so coming over the lower part of the scalenes, I'm not quite at the attachment. That would be about there. I don't need to go all the way deep in there right now. We're just going to make sure that there's good mobility between the layers. Yeah, a little bit of adhesion here where the upper trap inserts on the clavicle. And always very interested in the mobility of the coracoid process, which is right here. And everything attaching to the coracoid from below, the coracobrachialis, the short head of the biceps, and the pec minor. And those things, all three of those are always involved when there's too much protraction, internal rotation of the shoulder. So we just got a nice little release right there of the pec minor. Good. Let's have a look at the left side. Okay, on the left side, let's see what we can feel. Similar. Just getting that already right there. That's subclavius. And also, got to be careful here because remember there's all these delicate tissues, but something is holding this left clavicle way superior. So it doesn't look very asymmetrical, but when I give these clavicles, again, that end feel, this right one now is nice and springy, and this left one now is really kind of stuck. Let's see. If I bring her head back to neutral, does that change it? No, it's pretty stuck. feeling where is it sticky, and it's sticky right here. So the first rib, the clavicle, and the sternum come together right here, and this is where she's having a little bit of problems. Famous acupuncture point, kidney 27. Kind of rules over the spine, and especially the upper spine. It's not a point that gets needled very much because it's close to the lung, so it's a little bit dangerous, but it's a really good one to work. If you're into acupressure and you like working acupuncture points, kidney 27 is a really good one. It's also one of those muscles that people tap when they do tapping for emotional healing. If you're familiar with that, it's a biggie. So, how you doing, Ashley?
Doing great.
Is this one sending any sensation anywhere?
No, it just feels nice.
Feels good right there. Good. There you go. Couple of deep breaths here. Good. Good. So getting a little more movement there. Feeling like now coming down to rib 2, rib 3. So this is starting to make me think about the pec minor, even though we haven't quite gotten there yet. Let's go there now, because that might actually be causing the restriction of these upper ribs. So here's her coracoid and the pec minor coming off of it. So this is a good way to demonstrate working in the upper chest on a woman. There's breast tissue that you don't want to push through or touch or expose. But if you want to be able to work this, it's good if she is laying face up. If the breasts are really large, you can have them laying on the opposite side, and then the breast will fall away from that side. And it's always better to approach this from above, or if she's lying on her side, from behind. And that way you won't accidentally rest your hands on the breast tissue, which would make your patient uncomfortable. So we want to be able to get into the tissues we need to get into while always preserving patients feeling comfort, relaxed, safe. Could you get this hand on the table so that it's not hanging quite so much? Maybe let's shift you about 2 inches this way. Thank you, Ashley. Good. Okay, so now she's more in neutral, and I'm sure it felt good to get a little stretch on the pec in that other position. Yeah, but I want to be able to feel it through neutral. So there's still some stickiness around this coracoid, and this is coming more from the superior, actually. So between the clavicle and the coracoid, there's the coracoclavicular ligament. And like all fascia, it is active, it is contractile, it's responsive to touch, it's sensitive. A lot of people have a lot of sensitivity around this coracoid. That's normal, typical, not necessarily indicative of a problem, but we're just getting a little movement. That's much better. You can see now that that bounces, where before it was kind of stuck. So that's good. So even though her issue in terms of symptoms was more in the back of the neck and across the shoulder blades, across the top, it's so important to make sure that the clavicles are freed up and that pectoral region is open and pliable. It just makes everything so much better. So this is just a little bit of a gentle work here through the neck extensors, putting some lateral traction through the upper trap and some medial traction through the upper cervical spine. So my hands are like working against each other like this. It's not a big stretch. A lot of people don't really like it if their neck is stretched into big, like deep rotation or deep lateral flexion. I'm one of those people. You can get movement through the layers and get the fascia moving with the head only a few degrees from neutral, because pretty much all those things that attach to the neck also attach to the shoulder. So I can keep her neck in neutral, put some traction through the shoulder, and in doing so indirectly get stretch through the neck without endangering the discs, without endangering the joints, and without making the patient scared. that I'm going to overstretch them. When there's a new patient on the table and I'm working on their neck, I will always say, I'm not going to surprise you with any sudden movements, and you will know before anything happens. Because people are worried when they're at a chiropractor that the chiropractor is going to do something dramatic and sudden to their neck without consent or warning. I would never do that. So here we are working the upper right SCM gently and getting a little bit of work through that attachment and across the base of the skull, the occipital ridge. It's definitely a little chunky in there, consistent with a lot of chronic tension on those upper traps and neck extensors. And same thing here on the left side. So you can see the tip of my right middle finger holding C2 and the tip of it right on the back of the SCM, and then using that as a little bit of counter pressure as my left hand strokes through this way. So you can see the direction of my strokes being proximal to distal. And when you're working in the superficial layers, that's fine. If you're working at muscle level or deeper, you want to go in the direction of blood and lymph flow, which would be toward the heart this way. And then that left occipital ridge. Good job. Thank you. Looking at the time. Yeah, I don't want to rush it, so we'll do another one.
Okay.
Yeah.
Thank you so much.
You're welcome. Thank you. I appreciate your participation.
I feel so melty. My neck feels amazing. Thank you so much. Really.
You're welcome. Thank you.